Good morning. I'm Don Walker. I am the Communications Director for Brevard County Government, and we are here today with our biweekly update on the COVID-19 pandemic. And on our panel today, we have Maria Stahl, who is the Administrator with the Florida Department of Health Brevard. We have John Scott, who is our County Emergency Management Director, Catherine Allen with the Brevard Public Schools, and we also have Jesse Ray, who is the County Social Media Specialist. And our plan today is to provide you some brief updates about the pandemic and things that are going on in Brevard County, and then also to leave more time allotted today to answer some of the questions. We're getting pretty much daily questions from residents, and we're hoping that we can take advantage of this opportunity today to open it up a little bit longer and field as many questions as we can. So with that said, I'm going to turn it over now to Maria Stahl for a pandemic update.
Thank you, Don. And I am Maria Stahl, the Administrator of the Florida Department of Health in Brevard County. And I will go ahead and give the COVID update first. Currently, we have 28,605 cases that have been diagnosed in Brevard County. Today, we have added 217 cases. The average age of our cases is predominantly in the 40s. High 40s to low 50s. Our positivity rate for today was 5.98%. However, it's really important, as I had said before, to look at your overall positivity rate, or at least the trend over the last 2 weeks. Over the last 2 weeks, we had 8.5% positivity rate with 3,340 cases over the same 2-week period. Overall, since the beginning of March, we've had 13.06 positivity rate. Our deaths, we are unfortunately up to 627 deaths, which is adding 5 deaths today. 52% of those deaths are associated with long-term care facilities. 88% of the deaths are over the age of 65. To report our hospitals, they're very busy but stable. They have capacity and they're doing okay. It's very important, and I'm going to stress this again, even with vaccine coming out, it's extremely important that we continue our mitigation measures. Our cases are still up there. We do need to continue with face masks when you're out in public and you can't maintain social distancing. You need to stay home when you're sick. This is very, very important. We're going to be in this a little while. Vaccines. To talk about vaccines, we've had 40,099 vaccines administered in Brevard County. Out of those, 33,404 have been the first dose vaccines. I can tell you the vaccines that we're getting in, we're getting out as fast as we get them in. And there is just not enough a supply at this time. That's really what I have right now, Don.
All right, Maria, thank you for that update. And for an update on the vaccination program, we'll turn it over to John Scott with Emergency Management.
Good morning. Again, my name is John Scott. I am the Emergency Management Director for Brevard County. And I want to build on a couple of things Maria talked about. When we got together 2 weeks ago, we talked about a supply problem. And unfortunately, we're still talking about a supply problem. That is the primary obstacle we face when it comes to our vaccine operations, and I know it's the primary obstacle that impacts all of our residents. We understand and recognize the emotion that goes behind wanting to get the vaccine because of the hope it represents. We also share that hope and share that emotion to get it out as fast as we can. You heard Maria talk about it. As fast as we get shots in, we get them out. In fact, the vaccine pod today is closed because we're out of shots for the rest of the week, first shots, that is. So we are really doing I think a really good job of getting shots in and out and into arms as fast as we can, but the supply continues to hinder us. So that's my sort of that's my not necessarily positive news to start with. Let me talk about some positive news going forward. If you may or may not be aware, several weeks ago, the commission approved $2 million to support expansion of vaccine operations. And then last week, they continued to demonstrate that support by approving partnerships that the county is entering into with our three major hospital systems. So that's Parish, Steward, and Health First, that will allow us to expand our vaccine operations with them. It also allows us to hire a contractor to help support an additional large mass vaccination site. So those are great steps forward in our expansion of capacity when we get the supply. It gives us the ability to do about 18 to 20,000 shots a week. That is, however, not going to be turned on tomorrow or imminently, because we are still only seeing about 1,500 to 3,000 shots a week coming through from the state allocation, and we're able to do that with our current site at Viera. I know also we've heard from a lot of residents about the need to get out into the community. We are well aware, Brevard's a very long county, 72 miles long, 22 miles wide. We are a very diverse population. We have folks with access issues, either through technology or through transportation and means. We absolutely want to get out into our community and sort of reach that in a more targeted way. Fortunately, Publix is online, so that helps us do that just through the 22 Publixes we have throughout our county. But we know we still need to get out, especially in the underserved communities, and we continue to partner with the state where we can for that. The major obstacle for us and being able to sort of leave our central location is supply. We have plans and partnerships in place to do outreach to these organizations in our different sort of pockets of community, but we can't do that until we have the kind of supply that allows us to do that. So I know we get a lot of questions on that. I don't want people to feel like they're not being heard. We recognize it. We see you. We just can't get to you right now because we don't have the supply. But all of our efforts are focused on getting shots in arms as fast as we can and building the capacity so that once the shots get here, we are able to scale up rapidly and get them out rapidly. And lastly, I'll just close with, I want to say thank you. I want to say thank you to all of our residents for your patience as we go through this process. I know when we put appointments out there, it's a mad dash to get them, and we're going to talk about some of those ways in which we can hopefully help navigate that a little bit better. But there is such a high demand that they are gone so quickly, and I know the frustration that goes with that. We are doing everything we can to expedite where we can. When supply increases, I promise you this will get better. This will get faster. It is all driven by supply. So thank you for hanging in there. Thank you for being patient with us. And please continue to stay with us as we do this. We will get through it. Don?
Thank you, John. We're going to turn it over to Catherine Allen now with Brevard Public Schools for an update on the school system. Catherine?
Thanks, Don. Again, my name is Catherine Allen, the Office of Government and Community Relations with Brevard Public Schools. So cases in our schools are trending in a similar trajectory to the larger community transmission that we're seeing. So those of you who follow our dashboard, you may be noticing that we've had a little bit higher numbers in cases and quarantines. Again, schools are simply a microcosm of what's happening in our community. So our schools continue to do a great job with mitigation protocols, masks, hand hygiene, social distancing when possible. And we ask that our parents, please keep your children home if they don't feel well. All of those things, that's what we can do to help control this and play our part. We would like to use this as an opportunity to let our community know that we need substitute teachers and we need bus drivers. As you can imagine, the pandemic has certainly, exacerbated the need for those amazing people. So if you'd like more information about what that might look like, what the requirements are, we'd love to have you visit us at www.brevardschools.org. You can scroll down and look to the right of your screen under FAQs or simply click on our careers tab. That's all, Don.
Thank you. So at all of our biweekly Facebook updates, we have always allowed time for questions because we know there's a lot of them out there. But this time we've allowed even more time to field some of those questions. And we've got Jessie Ray, as she has in our other events, monitoring your questions on Facebook, and we are going to take some of those questions now. Jesse?
Okay, thanks, Don. One of the questions that we got is, has the volume of vaccines allocated to our DOH been reduced?
What I can say is the allocations to our local health department has varied from week to week. Some weeks it's gone up and some weeks it's gone down. What I can say is last week we did have a 2/3 reduction to our health department. However, it wasn't a reduction to Brevard County. Publix did receive some of those doses, so there was the same access to vaccines in Brevard County.
Gotcha. Same amount of vaccines in Brevard County.
Correct.
Just different of who was
Different
getting it.
locations.
Great, gotcha. Okay. Speaking of that, so what is being done with the unclaimed vaccines? People make appointments, they don't show up. What happens with those vaccines?
There is no unclaimed vaccines.
Okay.
We make sure we use every single dose at the end of the day, so we do not have any unclaimed vaccines.
Gotcha. So when will others who are not 65 and older and not healthcare workers be able to be vaccinated?
That is a Governor DeSantis decision. So
Gotcha.
that's not anything that I can answer locally.
Got you.
Yeah, but we should clarify, though, that the reason we're doing 65 and older, and the reason we're doing healthcare workers who have direct access to patients but are not affiliated with the hospital system, and also that we're doing Florida residents and not out-of-towners, is because all this is dictated by the executive order from the governor.
Right, and I'll also add, Jesse, to that, as I said in my report, 88% of our deaths are related to those over the age of 65. So that's truly where we want to get the vaccines at this point.
Gotcha. And we started to touch on this a little bit with what you were saying, Don. Why can non-Brevard residents get vaccinated here in Brevard?
I'll take that one, Jesse.
Okay.
So a couple of things. One, remember this is it's a federal program we get these vaccinations through. And we talked a little bit about it last time we were all together. Two, the governor's been very clear that this, in a disaster, we are one state on this. So if you are a Florida resident, whether that's a full-time or part-time, you don't have to get the vaccine in the county that you live in. If you're able to get an appointment somewhere else, that's great. If you are able, you have friends in a different county or family in a different county and you guys want to go together, that's also great. And we want to get out as many vaccines as possible. I know it can be frustrating for Brevard residents because they think they're competing against, everyone else. But I will also share we have Brevard residents going to other counties to get vaccinated. So it is 100% reciprocal.
That's right. We had one person who asked, why aren't we doing first dose, first priority like other areas? In other words, people are coming back for their second dose. Why aren't we using those second doses to make sure everyone gets their first dose first?
We're currently following CDC and state of Florida guidelines, and at this point, there has been no guidelines to say not to give the second dose. So we do follow the guidelines that come out.
Gotcha. Okay.
And Jesse, I know there are some questions. I want to sort of reframe a couple things, which is, our job in Brevard County and at the local government level is to really follow CDC and state priorities. The CDC or the federal government provides the vaccine. The CDC provides recommendations. The governor and his team look through it, set the priorities, and our job really is to execute. I know that can be very frustrating for our residents because we are on the ground and we interact with them and we care very deeply about our residents and we have deep personal connections with our residents and our community. That's why we focus on building the capacity and the capability so that once the state and federal government are able to supply us appropriately, our residents aren't waiting, they're getting it as fast as we can get it to them.
Gotcha. We often get the question that I don't have a printer at home, but I have a ticket from Eventbrite. Do I have to print out my ticket and bring it with me? Or is a digital ticket okay?
A digital ticket is great. And we would absolutely, if you can bring your ticket from Eventbrite, we would absolutely love that. But as long as you can show proof of an appointment, we work with folks.
Okay. Sorry, I'm trying to also make sure I'm reading some of these questions. So I think that's a lot of those questions that I have. I'd like to take a minute to talk about Eventbrite. I know we get a lot of questions on those. And so I just want to take a second to talk about Eventbrite and some of the experiences that people are having. So, as you know, we do about, this last time we did 1,500 appointments. And when you consider that, roughly 50,000 or more people are trying to get onto the exact same link as you are at the exact same time, some people are able to get through and other people are pushed into a waiting room. And people have asked us, what does it mean? What do we do? I sat here, for 2 hours with the waiting room refreshing and things like that. Honestly, if you've made it to the waiting room, there are probably 10,000 other people who are already trying to get those appointments. So at this point, it's really best to, you can try to refresh, you can try and come back later and see if there's a canceled appointment, but the chances that you're going to get through past the waiting room seems really, really unlikely, just from what we've seen. For those who have asked people or have asked us, it says that there's a ticket available. It's the button is orange or red, and I click on it, and then it says there are no available tickets. So what happens is, Don goes in and he's able to start making an appointment. He's filling out the ticket. Eventbrite sees that his ticket is still technically available because his registration is not yet complete. And so it will show, hey, this ticket is available. You click on it, and then it says it's unavailable. Well, it's unavailable because he's currently trying to reserve that ticket. He has 30 minutes to do so. If at the end of 30 minutes he has not completed his registration, it will kick him out and it will become available again. If he does complete the registration, then that ticket will be 100% offline, and that's when the system will show that ticket is no longer available, and that button will turn gray and not let you click on it. So we've had a lot of people that are very frustrated with that, and they can't understand. It says there's a ticket, I click on it, it says it's unavailable. Technically there's a ticket, but someone's already trying to reserve it, so that's why you're getting that. Why?
So but let me ask this
Go ahead.
just to clarify, though. So if I get stuck in a waiting room or I see what you just described, I mean, there's no reason, because we sold out tickets this week for the 1,500 vaccines in as little as 3 to 11 minutes. So, and we've heard from people who've waited 2 hours thinking they were in a waiting room and were going to get a ticket. If you're waiting more than, like if there's 1,500 vaccines and 1,500 appointments, and you've waited 30 minutes, you might as well log off for your own benefit, because at that point, that probably means they're all taken up.
Yeah.
So there's
Unfortunately,
no need to wait 2 and 4 hours, as some people have, hoping they're going to get a notification that they've got a ticket.
correct. The waiting room does not mean you're next in line to get a ticket. That's not what that means. So I definitely recommend, just for your mental health, that if you are in the waiting room, after you've waited 20, maybe 30 minutes in that waiting room, it's time to move on and try again the next time that we have tickets available.
Okay. And Jesse, I also wanted to address this too. The Eventbrite system is a system we're utilizing, but it's not a system we created.
Correct.
So
yeah.
we're using that to our benefit, because it helps us avoid having the first come, first serve, debacle that we've seen in other counties. It keeps phone lines from inundated, as we've seen in other counties and in our county. So as it currently stands, that's the best system we know how to allow masses and numbers of people to apply for tickets at one time without, getting jammed phone lines. But they are getting stuck in waiting rooms and ultimately leaving disappointed.
Right. Yeah, and a couple of questions are coming in, basically kind of saying what you're saying, which is exactly that. Eventbrite is not our platform, just like Facebook is not our platform, YouTube is not our platform. None of these are our platforms, but we use them to help disseminate information or to get reservations. These platforms are built for the kind of traffic and the kind of things that we're trying to do, so we're not going to reinvent the wheel. So yes, Eventbrite, there's only so much that we can do to create the event and help host the event. But as far as how the site acts, that is not something that we can adjust. How much?
And for those who have successfully obtained appointments, the system has worked.
Absolutely. But, and like John has been saying, it's very much a supply issue. When you consider, okay, so the text alerts, for example, we have somewhere around 60,000 people registered for the text alerts.
How many?
60,000? How many?
It's a little, it's less, it's about 20,000.
20,000? Okay. So we have 20,000 people that are registered. So 20,000 people are getting that text alert at the exact same time that you are and are also clicking on the site, and there's only 1,500 available. So I'm not great at math, but that right there is part of the issue here. And then, sorry, somebody asked a question and I was going to answer it. How much warning do you give that tickets will be available? So that's something we put it out on social media and we put out the text and that's it. That's the earliest, the Eventbrite site is not open any sooner than when we send out the social media and text alerts. That's when it goes live. How do you get on the text alert list? So great question. So on your phone, you want to open up your text message application. That is not Facebook, that is not Twitter, it's not social media, it is the actual text message application. And you're going to, in the to line, you're going to put the number 888-777. It's up there on your screen, 888-777. I know it doesn't look like a phone number, it is a phone number. Don't add any hyphens, don't add an area code, and then you're in the body of the text, you're going to write Brevard EOC, one word, Brevard EOC. You hit send. It's going to send you a text back. I think there's 2 texts that come back to you that let you know you are confirmed and you've been registered. Okay, so I hope that that answers that question. Sorry, I'm trying to read questions and answer them at the same time. Yes, so, sorry, this is awkward. So we, like John started to say at one point, we understand that there are people who are not as tech savvy, who don't have computers, who don't have access to the Eventbrite. And so, we understand that. And as we get more supply, we can use our expansion efforts. Until then, we suggest, we often encourage people to get your grandkids or nieces or, people who maybe are a little more tech savvy to help you. Have them sign up and follow us on social media. Have them sign up for the text alert so that they can help you. They really just need your date of birth, your name, your email, and a phone number to reach you. And if they have that information, they can help and reserve that ticket for you. If you have a neighbor, that kind of thing. People are asking, are their second appointments still good here in Vieira? If they have a second dose appointment, are we still good?
Yes. What I can say is every single person that comes through the Vieira Clinic for a first dose gets a second dose appointment. We are getting our second dose allocations in, which are reserved for second doses, not being used for first dose. So if you came through Vieira, you will have a second dose appointment. It's very important that you keep that second dose appointment. If you don't keep that second dose appointment, we can't guarantee there will be availability at another time. So, but everyone that leaves after their first dose is getting a second dose appointment.
Excellent. Okay.
While you're looking for questions,
Go ahead.
Maria, have we had any events where people have had reactions to the vaccine?
No, we did have one that had what we call a vasovagal, which can happen with any immunization where we did have to call 911. However, no, we have not.
All right, and I wanted to ask John a question. John, the governor's indicated that if he sees that a county has the capability of getting more shots in arms, that's what he's considering when he allocates the vaccines, correct? And that's one of the reasons it's so important that we have these expansion plans in place. We obviously cannot open doors and allow people to come in if we don't have the vaccine, but we can demonstrate to the governor that we're ready and able when that time comes, correct?
Yep, you nailed it, Don. That is absolutely what we need to be able to do, is show that we have the capacity and the ability to put shots in arms quickly. Right now, the state, like all of the other states, are suffering from the same supply issue that we are suffering from locally. So the governor only gets a finite amount of allocations every week, and then they have to figure out how they're going to dole it out between all 67 counties and all the different partners that are assisting. And I think it's important we talk about this. I know a lot of people want to talk about, okay, well, when do we know when we're going to announce appointments? How do we figure those kinds of things? It's all allocation and supply based. We typically don't find out what we're going to get for the next week until sometime between Thursday and Saturday. And it's varied this entire time. Sometimes we hear today, which is Thursday, and sometimes we won't hear till Saturday. Once we actually receive the supply, that's when we actually will say, okay, we got X amount. So last week was 1,500, so we got 1,500. As soon as we confirm that and we're comfortable that it was there, we open the appointments right away. And I want to just add this while I have a second, is I talk about when supply gets, sort of more robust, a lot of things will begin to get better. And what I mean by that is, right now we know we have 150,000 plus seniors in this community that would be eligible for this. We're solving that 1,500 shots a week. When we start to solve this problem, 5, 10, 20,000 shots a week, you'll see things. You won't have appointments that will be gone in 3 minutes. Appointments will stay open for, half a day, full day. As we begin to meet the demand, that will be easier to sign up. And then we can do the innovative stuff that we want to do, which is get out into communities, get out into underserved areas, get out into areas where people have less technological either savvy or capability, and really get shots to people in their community. We're just not in that paradigm yet.
Thanks, John. All right, Jesse, next question.
Okay, so, I'm seeing a lot of comments or questions about some of the other places who are doing vaccinations as far as Publix and Omni or Health First, and, we don't really have any control over how they're doing it or what they're doing. We have our vaccines. We are using Eventbrite. Publix's site or any other sites or how they're doing their vaccines is not necessarily something that I don't think we have a whole lot of hands in that process. So while, if people are frustrated with that, I'm very sorry, but that's not necessarily something that we can answer your question to on this live today. I'm sorry.
Yeah, John or Maria, do y'all want to address that at all, the Publix vaccines?
Again, we're excited to have Publix on board because we know we've got 22 Publixes throughout the county. That gives us at least a little bit of options to get out larger or sort of into a larger area of our community than just primarily in Viera where our main pod is. As far as their processes and goes, that is their process. It's their system that works for them. I think they're using the system they would normally use for regular flu vaccines and things like that, just plus an online ability to sign up. I know Publix is suffering from, just like our other partners are suffering from, just again, the demand doesn't meet the supply. It just, we have significantly higher demand than we can fill. So Publix sells out quickly. Health First sells out quickly. That's where we are right now.
Right, and when John says that's where we are, that's where all the other counties in the state of Florida are, and that's where a lot of counties are finding themselves across the nation. So, this is not a Brevard County specific issue.
Right.
Jesse?
Yeah. Yeah, and like you guys have said, it's also not us passing the buck. Like that's just the facts of the way that it is, and that's just the way it's being run. So we did get a question. So and you started to talk about it a little bit. What's the average time between getting the vaccinations in our hands to us putting them in people's arms? How much time usually?
So usually, once we confirm we've got it and we're good and comfortable with the number, we'll announce it. It's been, we're getting to a week-to-week model. So Monday we made appointments starting Tuesday and Wednesday, and then we were out of vaccine. So it is. Our goal is to make it happen that quickly. So as soon as we have confidence that we're getting that vaccine in that number, we open it up and then we get it out.
Okay. I saw somebody on here, and I think it's a good idea, so I thought I would share it. Pre-registering, if you download the Eventbrite app and put it on your phone, and you kind of do like a pre-registration of sorts, basically you're inputting your information, your name, your last name, your email, phone number, like that. When you're ready to go to an event and you click on it, it will just put all that information in there for you. So that's a great tip from one of our viewers. So, John, we've gotten a lot of questions and suggestions about a wait list.
Sure. So I know, again, there are a lot of folks who want to get on a wait list and talk about a wait list. I'll talk about why operationally it's a significant challenge for us. We know very quickly, based on the demand we've seen, that list wouldn't be a couple hundred people. That list would be tens of thousands of people. And we would now have a wait list that could be 10,000, could be 20,000, could be more than that, of people who want to be on a wait list. And that's great that we've got your information, but we don't have the ability to get you a shot any quicker. So we're still right now going to solve this problem, a couple thousand shots at a time. So they know you're going to sit on a wait list for a long time. And that's an expectation that we just don't want to set. Because, once you're on that wait list, it's okay, how quickly do I get off this wait list? When am I getting my shot? All of those fun things. We want to be able to get you, or at least an equitable shot at vaccines as soon as they are available. If we get to the point where we're getting, regular, 20,000 shots a week, absolutely we'll do a wait list because we can make a real dent in that. But right now, we're just going to give you an expectation that we can't deliver on because of supply.
Maria, how many shots are we averaging a day at the FDOH site?
Well, there again, it depends on what our allocation is. We have gone up to 1,000 a day last week, where we did get the 4,500 allocation. This week, we got 1,500 allocation, so we were down to 750. But we can go up to 1,000 a day in our drive-through if we have the vaccine to give.
Okay, and John, just to clarify too, I think with the expansion plans that we have in place, that we can demonstrate to the governor that we would be able to increase that number exponentially.
We get to 18 to 20,000 shots pretty quickly.
All right, Jesse.
Okay. So, we've been talking about the fact that once we get vaccines, we put those vaccines in arms. We have people who have second dose appointments. Are we going to get those vaccine doses to be able to give them their second dose appointments?
We have already gotten, next week, we will start our second dose appointments, and we have gotten the allocation for our first week. We got 3,500 for our first doses that came down, and we got 3,500 second dose allocations. So that obviously could change at any time, but right now I've not heard any indication that that will change. And we are getting our second dose allocations, as well as everyone that is got first dose vaccines is getting second dose allocation. So that's Health First, Omni. Publix hasn't been in there long enough, but everyone is getting their second dose allocations.
Okay, and we've got time for one more question before we wrap things up. Jesse?
Okay. So I think, a lot of the questions or comments that we're also still getting is just that it's very frustrating, and I don't think that that's lost on any of us. I think it's frustrating for us. It's frustrating, people that are here in our buildings that are coworkers and friends. Our family members aren't getting the vaccine as well. It's just to repeat what John said. It's a supply issue, and I think until then, it's going to be a process. So. Please hang in there with us. We're going to keep doing these. You can keep asking us our questions. And I think that's really all we've got that's usable for today, John.
Okay.
Don,
So,
before you,
go ahead.
do you guys want to talk about some of the videos we have to help people navigate?
Sure. Jesse, do you want to mention those?
Sure. We have a YouTube channel that we use, and we put up a couple of videos. So our YouTube channel, you can find us at SCGTV, that stands for Space Coast Government Television, at SCGTV 499 on YouTube. There it is on your screen. And so you can go there and you can see we've done a video on the text alerts that will give you a step-by-step process. We understand there are a lot of people who maybe have mobile devices but aren't exactly sure how or where to find their text messaging app. So we have a video there to help give you a visual step-by-step process, because I'm a visual person. We also have a video up there about navigating Eventbrite. Now, we've gotten a lot of comments on the video that says, well, this doesn't address the waiting room. This doesn't address what unavailable means. We understand that. What we want to do is show you how to use the Eventbrite app when you are able to schedule an appointment and what it looks like. And that's why we use today to kind of explain what unavailable is and what that waiting room is and what that looks like. So those are two videos that are very useful for visual learners like myself who just need to see what the process actually looks like so they're prepared.
Okay, thank you. So to end our program today, I just want to echo what Maria and John have stressed, and that is it's not time yet to let your guard down. We are trying to get as many shots in arms as possible. We're hoping the supplies will continue to increase in the days and weeks ahead. But in the meantime, we have to continue to follow CDC guidelines and recommendations. Wear a mask, social distance, don't show up for work when you're sick. And we'll be back in 2 weeks for another update, and we appreciate you tuning in. Thank you.